So I'm just going to run you through a scenario that is linked to the trauma qualification that we do in third year as part of the course. So the trauma qualification that we run is a RFU pre-hospital immediate care and sport level 2 course. It's a prerequisite of all BASRAC courses, so it's not unique to Salford from that perspective, but it is a course that we run before our students go out on their external placements or their main external placements at third year. And the course itself is, as I said, it's an RFU course, so rugby union, and it's required to work at certain levels of rugby union, and it's a prerequisite for the further level 3 course that's required if you're going to work at kind of international, premiership, championship kind of level rugby union. It's accredited by the Royal College of Surgeons, Edinburgh, and that therefore means it's equivalent to the same qualifications that you can get from football, so the FA ITMIF as it's called, and then the RFU's Rugby Football League's equivalent to that as well. The RFU course is actually one that they run throughout the English Institute of Sport, so that's used within all the Olympic sports, and therefore obviously it's very well recognised. The reason that it's been brought in from a BASRAC perspective is to improve employability and help sort of gain those skills for our graduates. As I said, it's delivered at level 6, and it's actually delivered by our staff, and we are all trained to deliver the course. We have external people coming from, often from Bolton University, because they're nearby, and we also go up there and help teach their course. And we also have somebody comes in from the RFU as a quality assurance each year. So that's just sort of a bit of background as to the sort of reason for this video. Now, the video that I'm going to show you is actually one of the players that I look after at Sedgley Park, and you'll see sort of myself and Ben, who's a PhD student. You'll see sort of our response to what happens, and you'll see our management of it as well. So I'm just going to get this playing, and you'll see in the next contact, excellent tackle technique by Mark, and you'll see bang, straight flat out, he's gone. So at that stage, you'll see Ben comes flying in from the far side. I'm already on. So the acronym that we use at this stage is called the SABCDE approach. So we have a safe approach. So basically we need to make sure it's safe for us to get onto the pitch. Fortunately for us, the referee was on the ball at that point, stopped the game, allowed us to run on straight away and deal with Mark. Now, you'll notice there that the first thing I've done is go in and actually grab hold of his head. Now what that's called is called the Mills manoeuvre, so the manual inline stabilisation manoeuvre. The reason that I'm doing that is the first concern there is Mark's C-spine. So there's potential that he's had a sort of forearm to the face. As he's hit the ground, there's possibility of sort of like whiplash type injuries or sort of a head injury, as well as C-spine or neck injury. So that's the first sort of thing that we deal with. Now actually, I made a slight mistake in running on and going into Mills position rather than anterior hold. Normally we're going to what's an anterior hold, where you hold the chin and the head so that you can actually speak to the player from that position. But because there's two of us, it works fine, and it's sort of part of the protocol that we run through. So you'll see Ben now calling for some help, because at this stage Mark was unresponsive in respect of when I first got there and sort of got into the Mills position. He then started talking to me a little bit. So the next part of the SABCD approach, after the safe approach, is airway, breathing, circulation. So when Mark started talking to me, I was able to sort of determine that his airway was clear, because he was actually sort of talking to me and helping me out. We could also establish his breathing was okay. So Ben had checked his breathing when he came on to make sure that there was no unusual sounds, etc., and that his breathing rate was normal, and that he didn't have any pain around his chest, which we weren't really concerned about because we'd seen the mechanism of injury. C is then standing for circulation, so that's where we're checking, making sure there's no obvious blood around the area, no blood around his face, etc., and also looking at whether we have a really elevated heart rate at that stage. So Ben had checked that whilst when he'd come on as well. Now, as I said, you saw Ben sort of call for help. You've seen a few bits come on. Scalpy, the old guy, stood up here. He's usually very well drilled in that. Unfortunately, he brought the wrong bag on first time around, the orange bag. He should have brought the big green bag, which is what Ben and Sophie, who was actually one of our second year students at the time, are dealing with there. And basically that oxygen is there to try and help perfuse oxygen to Mark's brain at this stage, because he was sort of responsive, but he wasn't sort of fully coherent at that point in time. So we recognise this potential head injury, and therefore we have to get oxygen straight on. Now, you'll see now that because of the situation that we're in, the split long board, so the big yellow board, was brought on, along with all the head blocks, etc., in the big green box. And they're now being prepped while we're dealing with Mark, getting the oxygen on, talking to him, seeing what's going on. Now, what actually happens during this period is that Mark comes around a little bit more. We use a scale called the AVPU scale. So it's basically on the pitch, determines whether they're alert, whether the player's responding to verbal stimulus, whether they're responding to a painful stimulus, or whether they're unresponsive. Now, when I first went on, Mark was only responding to a verbal stimulus, so it was V on the AVPU scale. But as we were dealing with him, once we got the oxygen on and started sort of, came around a little bit more, apologies for the camera movement there, we were able to determine that Mark actually moved up to being fully alert. So he actually then started talking to us, told us exactly what happened, said he was in a bad position tackling wise and that he'd been hit on the head, fallen down, and that obviously, now he was where he was. So he kind of knew where he was. We asked questions called Maddox questions to check that he was fully orientated. So he knew where we were, he knew what half of the game we were in, sort of who scored last, who we played last week, and sort of was fully aware of what was going on at this stage. So now what we're looking to do is actually clear Mark's C-spine. So to try and ensure that he doesn't have a C-spine injury, and therefore we don't have to take him off on the split long board that was brought on. So at this stage I'm now asking Mark to, although he didn't obey particularly well at the time, asking Mark to sort of turn his head and make sure that if he feels any pain or any blockage or anything like that, that he stops immediately and we go back to the initial central position. So Mark was sort of listening to what I was asking him, moved his head without any particular pain. Therefore, at this stage, you'll see we now start to get Mark sat up. And we run through exactly the same procedure again, so make sure there's no central pain with his neck, and also ask him to look left and right, just to check that, again, he's got no pain and no symptoms of a C-spine injury. All this has happened sort of quite quickly on the pitch. I think it takes us 5 minutes altogether to get from it initially happening to us getting off the pitch. So you'll see Mark then is able to get up, walk off with oxygen still on, because we're still not sort of 100% happy that we want to make sure that he doesn't deteriorate in any way. So at this stage we sort of walk him off, and essentially he's suffered what we class as a head injury at that point. It's potentially concussed, although he came around and he's fully alert. Now, concussion is quite a big debate in the area of rugby and in sort of contact sports. It's something that we take really, really seriously, and the players recognise how serious it is and tend not now to try and pull the wool over our eyes because they recognise the long-term implications of possible head injuries. But that is just a really brief snapshot, really, of one of the reasons that we do this immediate care course, is that a lot of our registrants and our graduates from the course go off to work in sport, obviously, and will end up working pitchside or courtside or whatever it might be, having to deal with these kind of scenarios. So that's just a quick show to give you a bit of an idea of how we work, and how that works in the real sort of scenario. Fortunately, we don't have to do it that often, but we've had to spinal board. I've been working rugby for about 13 years now, basically since I graduated, and I've had to spinal board a handful of people in that time. Obviously, dealt with a lot more head injuries. Unfortunately, only seen one severe sort of neck injury, but I wasn't present at that particular game. It was one of our players that was playing in the second team game, who then suffered a C-spine injury. Funnily enough, it's when I was at a club called Caldy, and they were playing Sedgley Park, which is the club that I'm at now. And that was dealt with brilliantly on the pitch by another BASRAC registrant and another Salford graduate, actually, who had run through this course and therefore knew how to deal with it. So fortunately, it helps us really deal with players in the best and most efficient and safe manner. So it's not somewhere everybody will end up, but if they do, it means that they're ready for it, and it helps in improve employability and stand out from other professions such as sports therapy and physiotherapy, who don't run these courses as a mandatory course at every university like the BASRAC accredited courses do. So thanks for watching that. Obviously we'll pop back over now to the online session, and I'm sure you can ask any questions that you'd like to ask at this point, and I will answer everything that we can.